FamilyAffaires.com contributor, Dr. Dan Gottlieb. Welcome back, Dr. Dan.
No, it's a pleasure to be here.
Dr. Dan, today I'd like for you to discuss post-traumatic stress disorder, or better known as PTSD. Many times when we talk about post-traumatic stress disorder, it's pretty much related to the military. When soldiers are coming back after fighting a war, that they develop PTSD. You know, their families go through the stress of them having the PTSD. So I'd like for you to educate our viewers a little bit about post-traumatic stress disorder, and especially the families of the military. You know, what kind of help they can get for it. And exactly what are the symptoms of PTSD?
All right, you just asked a lot of
50 questions, I know.
And you've shaken me up here, so I need to call my therapist and then I'll... the VA has a bad reputation for providing services, but the VA is also on the cutting edge of the most effective treatments for PTSD. I'm not addressing the access problem.
Okay.
But their research arm and their clinicians who are studying PTSD and the difference between PTSD in men and women and which treatments are the most effective, the VA is on top of that. So you want to know about resources, those are resources. Before we get to symptoms, it's important to know that PTSD is a normal reaction to an abnormal situation. That's so important for anybody who's experienced trauma, that you're having a normal reaction to an abnormal situation. This is what people do when their lives are threatened, when the lives of their loved ones or friends are threatened, when their physical integrity or emotional integrity is threatened, when they feel helpless and hopeless, all at the same time. You're having a normal reaction. And everything you do in the wake of that is about survival.
So it's actually a defense mechanism.
A protective mechanism.
Right, okay.
So that when you're sitting in a room with somebody and their eyes are darting around, or if your eyes are darting around, that's your brain still engaging and trying to protect you from potential danger. Now, part of your brain doesn't know that you're safe at the moment, and that's where the therapies come in.
Okay.
But you can see my point here, that it is a normal reaction to an abnormal situation.
Do the symptoms, I want to talk about the symptoms, do they usually occur soon after the incident that causes the trauma, or might it be over a period of time?
It can be over a period of time, sure. That, you know, you come home, the shock wears off, you know, you're integrated into a new situation, but shortly thereafter, symptoms return because you're bringing the war with you. You're bringing that trauma with you.
The experiences.
And more often than not, it happens right away.
Okay.
Right away. I've got a dear friend of mine who is University of Miami, Amishi Jha, and she works with military families and veterans, non-veterans, military people who are going overseas.
Okay. We're being deployed?
Thank you.
Okay.
Who are being deployed. And she teaches them very short-term mindfulness practices, and that they can employ over there
So it's almost like a prevention
It,
method
it,
of PTSD.
It's not almost like.
It is.
It is a prevention. When she's done controlled studies of this population, this group of people are much less likely to develop PTSD, as are their family.
Is this practice been integrated into the military, part of the training, or is this something that she does separately and it's private?
It was contracted by the military.
Wow.
And now it's being introduced more and more. Look, I just met last week with a veteran with PTSD, a lovely young woman who was in a tank, when a bomb exploded, and she got a concussion, and a couple of people in the tank died. She was okay. She's got PTSD. And we're sitting in my office, and she's just a lovely young woman. And just my heart opened up to her. So she was telling her story. And I found myself holding her emotionally, not tightly, just holding kind of the space around her, just psychologically. So she was telling me her story, and I could see her anxiety was going up. And I said, okay, now, tell me about the space you're in right now, and how your body feels with your feet on the floor, with your hands crossed, with your back on the sofa, the chair. Just feel your body. And I asked her to listen to the ambient sounds around. And then I said, what does it feel like to be with me, with this other human in this space? And she said, I feel safe. So all we had to do was activate the part of her brain that was conscious of what was happening right now. And that's what mindfulness really is.
Sure.
So allows you to experience what you're really experiencing, as opposed to experiencing
What your mind is telling you and getting caught up in that. Quickly, I want to talk about the symptoms. If somebody thinks they're experiencing PTSD, what would be the symptoms that they would be having?
I'll give you the symptoms, and then I'll give you the answer.
Okay.
Because they're two different things. Avoidance of the situation, avoidance of the things that trigger the situation. Intrusive thoughts that the situation is in your head and it's impairing the function, your own function or your cognitive function. It's alterations to your arousal. I've got PTSD, and my startle reflex is, my threshold is close to zero.
Okay.
Anything's going to startle me, and you're going to be more reactive to what's going on in your external environment. Those are
nightmares, I think, are part of it.
nightmares. Yeah,
That's the part of the reoccurrence.
Yeah, you're not going to have all these symptoms,
Right.
but these are the symptoms. But here's the answer to those who wonder if they have PTSD. Forget the label. You're suffering. So tell me about your suffering. Ask yourself the question that any good therapist, any good pediatrician would ask. Where does it hurt? Where does it hurt, and how does it hurt? Not why does it hurt, or what the hell the label is. Who cares? Where does it hurt, and how does it hurt? And then, what do you need? How can we help?
Great information. Thanks, Dr. Dan.
Sure, thank you. Take care.